What's up, guys? Super pumped. We got the one and only Chris Jamison in the house today. Chris, tell us a little bit about yourself.
So I'm a singer, worship leader in Pittsburgh, and what brought me to you was a bunch of jaw pain on my right side particularly. That was the kind of culprit of how I ended up here. So,
Jaw pain, TMJ issues, singing, super important to have healthy mouth, healthy jaw, healthy cranial and sacral function. We started with you about 4 appointments ago. Last week, Chris said, jaw
Doing much
pain,
better.
doing much better.
Still there, it's still tight, but it's not as painful as it was.
Nice.
Yeah.
So for our first couple appointments, we've been working on some TMJ work. We'll do a little bit of that on video. We talked about some jaw stretches, some wide stuff to get the TMJ to open up. My left TMJ has been clear ever since I started doing a lot of cranial therapy. My right TMJ has been my side that I figured out is tied into my right finger, my right collarbone, my right foot, much like what Chris is dealing with. Still has some pain over in the pterygoid muscles on the left, but a lot of his TMJ stuff on the right side is kind of like up here. So we've done a little bit of hyoid work, we've done a little bit of SCM work. I'm going to show you what and how the fingers and the wrist are tied up into the jaw and how circulation is important to clear out the cervical spine. Cool? So Chris, one, check out his YouTube channel at
I am Chris Jamison.
I am Chris Jamison. Nice.
So that's what it is. I don't look at it.
So Chris, Bree, we're going to zoom up down here on his hands. So something we just worked on today was our palm raise, and let's come up and out on the pinkies. And Bree, I need you, there's your weak spot down there. Heads up, chin's back, shoulders softly down. And Bree, I want you to, if you can, come over here. And we're gonna look down here at his hand, and we're gonna see, if you guys can see down here, see this white patch and these white patches right there? But notice there's like a little bit, just a little bit of whiteness, which means avascular, not so much blood flow, but he's really got an issue in his right middle finger. Now look at the right, or the left side, sorry. The right side, we've got a big white patch here and all of these fingers underneath. Can you raise this up a little higher? Nice. So he's got a ton of whiteness down through here and a lot on the outside, if you can see that on video. Maybe you can brighten it up a little bit. But Chris has, we want to stretch his back chain out, his front chain out, and we want him to feel, as we do this exercise, shoulders gently down, how much tighter the nervous system, the cervical spine, the cervical brachial plexus, the nerves from the neck down through the shoulder, down through the arm, how tight is this?
Pretty tight.
Pretty tight. If we turn,
Oh, more tight.
more tight. So we want to find the position that stretches the area out, that reduces tension up in the neck, but let's check the left side. Nice. Now this side's still going to be tight, but it's going to be tight in a different way. Is that correct?
Yeah.
Different areas maybe.
Yeah.
So just because we got right TMJ doesn't mean we have to just work on the right neck. We got to work and balance out the whole system. Chin tuck back, nice. What you may feel here, do you feel any pressure up in your neck at all?
Just sitting here?
Yes. Not really?
I don't think so.
Look down, pull back, lean left, turn right, tuck chin back.
Yeah, now I do.
Now you do. So we are isolating, and you got to find that spot at home for us too, okay? Now we're isolating up here in the C2, C3 vertebrae. And this is where he's all kinked up at.
Yeah.
So if the cervical spine's jammed up, you get tight neck, tight jaw. If we're stressed, we can get tight neck, tight jaw. I get stressed, you get stressed, he gets stressed, we all get stressed. What are we doing to attack our stress? Maybe prayer, maybe meditation, maybe yoga. I like exercise, I like movement, I like flexibility training. I like to heal people through movement and through identification of tight spots, but also weak spots throughout the body, so that we can maximize and stimulate and balance out the nervous system so that we get maximum healing. And if we do this, TMJ will never return unless we stop doing these postural exercises, or we don't work on them at home, which he's been crushing it at home, finding better back chain activation, Feel this guy right here.
Yeah.
Have you been diaphragm breathing a little bit?
Yeah.
Are you feeling your abdomen work a little differently?
Yeah, I'm not gonna lie, I'm not as focused. I guess I don't spend as much time doing that as I do with my jaw, just because I use my jaw.
Yeah.
Not that I don't use my diaphragm, but the jaws that has the pains, that's
What you're focused on.
But I need to, yeah.
And we talked a little bit about some foot stretching. Is that correct?
Yes.
Good. Because all the stuff up here in the lateral line is tied up from the neck, from the TMJ, down through the abdomen, and the whole way down to the outside edge of the foot. So you guys might see when I work on people, I kind of like stretch my foot out like this because it's a good position to help elongate the peroneals, the leg muscles, the IT band, and it helps me to open up my neck a little bit better, which is something that he's got to do as well. And we'll work with him on that on some other appointments. Look down for me. Good. Let's take a rest and go. Let's go back here now. Palms behind us. Shoulders open. Nice.
I got one of those sticks too.
All right.
Well, I didn't get it. I actually had one of the, like a paintbrush extender.
Okay.
Down in the basement. I was like, oh, that would be perfect. So I brought it up and was
Working on it a
rolling
little
it
bit.
out my neck.
Sore, right?
Oh yeah, it's pretty. I mean, it's not the most.
Comfortable.
It doesn't really feel great, but I think that's the point.
That's the point. Attack the pain. If we don't go through and attack the pain, it stays there and it manifests into something else. And then we got to go back level by level, layer by layer, get the pain out of the body, get the connective tissue to ditch the tension, get the skeleton to loosen up, and then the brain can talk to the body with a loud, strong, prominent.
If you're tense in your neck, will that cause headaches?
Yes, so much, man. And what do we treat headaches with? Ibuprofen,
Yeah.
sleep it off. I can't go to work today, I have a headache. So posture, super important. Stretching, super important. Clear your headaches naturally, no side effects. A little bit of soreness sometimes post-muscle work, post-adjustment. Have you been having more or less headaches?
Less.
How many headaches were you having a month?
Oh, I have no idea.
2?
Couldn't even give you a number.
Yeah?
Yeah, probably.
You should never ever have a headache. So many people live day by day, month by month with these debilitating headaches. Their neck is so jammed up, maybe they're clenching their jaw, they're not diaphragmatically breathing down into the belly. So there's a recipe to get rid of headaches. And it starts with mindfulness, and it starts with making a little bit of change on your day-to-day so that you can sit a little bit better and reduce neck compression, chin down to chest. Straight down. What I want you to focus on now is I want you to just maybe feel how this kind of stretches lightly. Yay or nay?
This right side, I can feel it.
Like through the neck a little bit.
I don't know if it's a stretch or if it's just like some pain.
Up here in the neck.
A little, like all the way into the shoulder too.
Down here.
Yeah.
Okay. Now let's look up to the ceiling, and then you're going to go chin to chest. Chin to chest, way down. Straight down. And then up, and then 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 down. And then up, and down. Tons of stuff right through here we gotta keep working on, okay? Up, down, up, down, up, down, up, and down. Nice. Now hands aside. Let's go right here. Let's just let head hang down low, okay? Gently focus on elbows tall, and maybe let's focus on shoulders roll forward. And I want you to focus on kind of squeezing through your pec slightly. And I want you to focus on breathe in through your nose, and as you exhale, chin down to chest a little bit, And then just kind of maybe feel a little bit of this. Lean over this way. If there's any tension through this side, pull down through here. And if there's any tension over on this side, how's this left side feel versus right side?
Better.
A little tight through here.
Yeah.
Still on this right side.
Not as bad. It just feels different, I guess.
Stay right there.
Like up into my head, I guess.
Nice, good tall sit for me. Head up tall now. Okay, cool. So there's neck work. Now, other area where we had the primary complaint was TMJ. So your TMJ is kind of like right here, your temporomandibular joint. And what we have him doing at home is some ear stretching. Which we don't want to be painful. So you're going to continue to work big time by pulling this guy away, and by tugging this guy down, and by, gripping up different parts of the cartilage. You okay with this?
Yep.
Definitely down here by the lobe. I'm working through that, which is a little easier over there.
Yeah.
You want to kind of curl ears like this. And you can just get your hands up here and kind of wiggle them around. Okay. And then he's going to be working a little bit of TMJ work at home. Right in front of the tragus. The tragus is that little front ear flap right here. Open up gently. He's working on this spot right in the TMJ. And lean to the left. And just kind of move your jaw forward slightly. Or backward slightly. And now open up super wide. And try to stretch that right. And then you're going to hold that and you're going to rub and clear out some of the irritation up here and then back here, okay? And he's going to do this on a daily basis, and it's going to get sore. The ear may get sore. And then you're going to transition over forward to the TMJ, okay? You can do some deep pressure through the pterygoids, kind of like up here, over here, down here, down here. So you're just going to kind of play around and rub all this stuff out a little bit.
Yeah.
Close mouth softly. And when you close mouth, keep tongue on top of mouth. Teeth are open, but lips are closed. Those are your 3 tips for a good mouth. Last appointment, we talked about clucking. You want to hold the tongue, you want to hold your tongue on the roof of your mouth, kind of like right behind your 2 front teeth. You want to keep your teeth open, your lips closed. You want to feel how that pulls the jaw forward, kind of like this. Tongue on top of mouth, teeth open, lips closed. Focus on that stretch away.
I have noticed more crackling over here.
Really reach the jaw away.
Yeah, like that one. I can feel it.
Use your left hand. Pull your left shoulder down, like your right shoulder. Reach your jaw away. Howl to the moon. Up to the sky. Okay, nice.
Yeah.
See how that assist helps a little bit?
Yeah.
To open up. Cool. So, we're going to keep up with his treatment right there to the TMJ. Today we're going to get him adjusted. drastically. We talked on his first two or three appointments about the importance of a tall sit. So we got the back chain power, the spine power turned on. The lats activated, the neck decompressed. Stretch jaw away. Chin back down where it was. Like that. And now look down, way down, chin down. And crank this up for a little high speed. Chin straight down the chest. Tilt head back, jaw reaches up and forward. And kind of like this.
Turn gently left.
See all good?
Mm-hmm.
Okay, cool. Last thing I want you to do today, I want you to start to get comfortable with your trachea. In your trachea, you have this little bone under here called the hyoid bone.
Mm-hmm.
What I want you to do with the trachea is just start sliding and gliding like this. See how that's kind of like crunchy-ish in there?
Yeah.
Good to get lymph fluid moving. Good to just get comfortable doing this. And then you're going to work up here. That needs to loosen up a little bit as well. And you're going to start to shift this with your hand up here. And then lower. The hyoid bone and the trachea to slide and glide left and right, really important for tongue strength. Last point, we talked to him about grabbing his tongue and stretching it out so we can reduce tension up in this like glossopharyngeal region, the submandibular region, jaw stretching to realign the TMJ, definitely neck adjustments, thoracic spine adjustments to just balance everything out. Cool?
Mm-hmm.
Do this a couple times a day real quick in the car. Get this nice and loosened up. Hum it out a little bit or growl it out. When you hum, like my dysfunction is kind of like over here. So if I hum at a tone, I get a little bit of weirdness over here. I feel it.
Yeah.
In the car, hum. Okay?
Mm-hmm.
Get that voice to loosen up. Let's go face down on the table. Right. Right leg's doing a little better. I'm going to take shoes off, all right?
Sure.
And knee. Push into hand. So straighten knee. And stop. Push. Stop. Push. Stop. Push. Stop. Push one more time, big man. And stop. Nice. Good. Back down. Bend up here. Push here. Stop. Push. There goes adjustment already. Stop. You guys see how this left side's a little clearer push than the right side is. We get a little further with this left knee. Almost healed about. One more time, big push. And stop. Nice. Back down. Bend here. So that left side was close, right side we're still push. So front chain musculature, lateral line musculature, stop. Notice how this leg's a little weaker on this side too. Push, it twitches a little bit. Stop. So we can't ever just treat the area of complaint, because if we really want him to be well and feel well, we've got to work that whole right side out. And here we go. Breath in, exhale down, shoulders down and relaxed. Nice. Breath in and exhale down, shoulders down and relaxed. 1, 2. There we go. Breath in and exhale down. And breath in and exhale down. Relax mid. All right. So getting a little bit easier in the thoracic spine. And inhale deep and exhale deep. Nice. Other side for the low back. No low back pain, right? No. Feels good in the low back. Things adjust well. Bottom leg straight. He's nice and decompressed, nice and loose, nice and active in the low back. Deep breath in. Exhale out. Roll it. Open it. Nice. Flatten your back through. So we got all kinds of low back adjustments. Lots of decompression in the low back. And here. What we added on 1 appointment or 2 appointments ago was to try to remember to lay in bed at night, flex your left foot down, flex your right foot down. There goes an adjustment just with the right squeeze. He'll cramp on the right side, somewhat easier cramp or stronger cramp on the right side. The left foot will feel a little bit better connected to his brain. So we got to get this neurological energy down to this right foot. And then left side, he's going to lay in bed and work on this, getting his feet to curl and twist downward. So we can elongate all this whole right side that's jammed up in his right side neck. Relax your toes. Now right foot, relax right foot, and right toes. Nice. But good to see toes and feet are generally decompressed. We just want the ankles to start to bend a little bit better. Twist knees open for me lately. Focus on left knee open. And now right knee open. See how that side's like a little different on this side?
Yeah.
And you're going to work on gripping and squeezing these guys down at home, okay? And then at some point, we're going to get this thumb to clear. With the elbow, let's see if we're there yet. Not there yet. Not yet. Did we get it last time or no? Not yet. Feet down gently. Left hand. And then we know he's got his left. We got both thumbs to clear too. That thumb moves. Let's see this. There's that one. Hands up here. Shoulders open. And now easy on the left, relax. Nice. Easy on the right shoulder. Yeah. Nice, row. Okay. What's this stuff feel like over here?
Not great.
Not great.
I don't know what that is. Well, you probably know what it is.
Feel this here?
Yeah.
Okay. So we always got to clear tight areas. Bad stuff, bad energy, bad stuff, tightness, muscle tension. You get diagnosed, oh, I got tendinitis or whatever. What are you going to do to fix it? You're going to do all this stuff to fix it, and then you don't have it anymore. Once you get mindful with your exercises, your stretches, your posture, bad energy leaves your body easier. Your body's cleared. it feels better, it adjusts better. He's adjusting much better. Neck's decompressing nicely, low back's decompressing nicely. Relax feet down. We don't want to be holding tension down the feet. People hold tension in different places, so we got to think about where the brain holds tension at. Let's see this right elbow again. No thumbs yet though, so we'll work on the thumbs at some point. Okay? Sit up tall. So make sure that he's doing at the dinner table or at church or wherever we're sitting down at, we're starting to sit on the outside edges of the feet. So pick your feet up and you're going to turn them in like this, and you're going to start to just get comfortable. Where I really want you to work is to get on the top of the foot, and I want you to gently squeeze your toes like that, and you're going to just feel how your left foot may cramp up or strain a little bit, and then you're going to focus on your right foot a little bit. You might cramp up on the inner leg muscles. You're going to kind of push down through the outside edges of the feet lightly, and you're going to start to stretch this way at home. And this should be done at the dinner table or kitchen table. Anytime you're sitting, I want you to start to think, can I turn my feet in like this and stretch a little bit? This will help us long-term loosen up and direct more tension out of the neck, the upper body, get more flexibility down the front, which ultimately turns into more strength and power up in the pelvis when it's down in the legs, okay? Good to do this, put your hands behind you, and if you go palms up, fingers up, shoulders open, and start to wiggle a little bit, or even just kind of like drive forward like that. Is that cool? Yeah. So just kind of sit on the couch and do this at home. If you're having dinner, you should always be working on 1 foot back or 1 foot forward, kind of tucked down and under like this. Okay? Yeah. Let's go do your laser of your neck today. All right, guys, so today the other thing we're going to do with Chris's jaw, TMJ, deep tissue laser therapy. Deep tissue laser therapy helps to improve ATP regeneration, helps to cycle and filter out oxidative stressors out of the inflamed areas. Deep tissue laser therapy, the one that we use, this is called a light cure, light force class 4 medical laser, and this is a deep tissue laser, meaning that it's a hot laser, it's not a cold laser. So there's different levels or classes. There's like class 1, 2, 3, 4, and 5, and like a class 5 laser is an industrial one that slices and cuts through metal and wood and whatever else you're using it for. Class 4 laser, hot. Too hot?
Feels hot.
Yeah, you tell me when it gets too hot here. And
it's probably too hot.
Okay. Let's go down here, tilt head to left. So deep tissue laser, brief, you want to show what this looks like. Lasers, and then there are hot lasers. And this is a hot laser, so it gets very warm, but basically it's creating a process called PBM, which means photobiomodulation, and that is a process of increased or improved ATP regeneration. ATP is your body's energy molecule, and this is a form of light therapy. Light therapy helps your cells that are damaged, whether they're muscle, bone, cartilage, tendon cells, whatever tissue is damaged, it helps it to regenerate at a faster pace. Also helps improve circulation drastically. Let's think about tongue on top of mouth, gentle teeth open, but try to keep your lips closed. So we use deep tissue laser therapy for a number of things here in the office. One of them is TMJ, broken bones, strained muscles, sprained ligaments. Whatever your injury is, you have 2 options. You let it rest and it takes forever to heal. It might take 6, 8, or 10 weeks, or maybe the pain never goes away and you might have complaints about it. You might be dealing with it for a long period of time. Deep tissue laser therapy is amazing. We have helped patients with broken wrists, broken ankles to heal within 2 to 3 weeks using anywhere from 6 to 10 or even more, 12 to 18 sessions of deep tissue laser. For Chris, this is his first session with it today, and what he's going to expect after we finish with the laser, the region is going to be hot, and it may be hot for the next 2 hours, might be hot for the next 8 hours, or it might just go away after the next 20 minutes. Everybody responds a little bit differently to deep tissue laser. Here in the office we call it DTL, and again the goal is to reduce chemicals from inflammation, so cytokines and interleukins and these pain producing chemicals, but also to improve the circulation drastically to the regions of tightness. Really twist your head or tilt your head to the left, like that. And so one thing we're going to see as we continue to work on him is that this line of muscles loosens up a little bit better. His extension and lateral flexion over to this right side gradually improve. Jaw pain continues to go away. Posture continues to improve. But overall, the toe, the feet, the toes, the feet, the lower legs, and the extremities will move better. Energy will improve. Circulation will improve. Pain will go away. How hot's the jaw right now? A little bit or not so much?
Not as bad as it was.
Good. Let's do this another 20 seconds right here. We also use DTL in here for like ear infections and chronic lymph node swelling in the neck. Typically you'll see after just 2, 3, 4 treatments, whatever your complaint is, pain will go away. Longer term is continuing to exercise and stretch the right way so that we can continue to make good lifelong improvements in our awareness of our posture, right? And just overall feel better. Now chin straight down to chest. Now we're going to come around, we're going to hit the left side cheek where you got those pterygoid muscles that are a little tight out. So lean. Open mouth a little bit wide. So 10 seconds. Nice. All right, bro. There you go.
Okay.
All right, guys. So these are lasers or glasses for the laser. Don't want to shine the light into your eye. These are polarized. Deep tissue laser therapy. It's red light therapy, so it helps improve circulation, improves ATP regeneration, reduces aches and pains, just helps things to grow back faster. Cool.
Cool.
Thanks for the
Thanks,
video.
man.
Check them out on YouTube, guys. I hope you enjoyed the treatment. This is our TMJ protocol here at the office. We're going to follow up with them next week.